Good evening, folks. Thank you so much for being here tonight. Welcome to the WUSC building. Very happy to have all of you here. It's a nice opportunity, a nice space for us all to come together. Tonight, we are going to hear from Dr. Ryan Mieli, former leader of Saskatchewan's NDP and author, on his new book, A Healthy Future, Lessons from the Frontlines of a Crisis. Pretty exciting book. Thank you very much, Dr. Ryan, for being here.
Thank you, Josh.
You're welcome. And then in conversation with our friend, Danyaal Raza. So thank you very much, Danyaal. Danyaal is a doctor physician, actually, a family physician at Unity Health at Toronto's St. Michael's Hospital. So thank you very much. Oh, and I should say an associate professor at the University of Toronto as well. So thank you very much for being here. I'm looking forward to this conversation. So please entertain me. Thank you.
Okay, so Ryan, Josh was giving a bit of your bio, and I want to just let folks know a little bit more about your medical practice, because you've spanned so many different areas. You've worked in like downtown Saskatoon and rural northern Saskatchewan. You even spent time in rural Mozambique. So all of this kind of predated your time in the Saskatchewan legislature, and then as leader of the Sask NDP. And this is it's a bit of an unusual combination. Family doctor, social democrat, political leader. Can you tell us your origin story? Like, how did these? I mean, you're a hero to me. You're a mentor to me. So tell us, what's your superhero origin story? How do these come together?
No radioactive spiders. Yeah, where did all that come from? And we were talking the other day. It's nice to be here with you, another social democratic doctor. It feels like we've had kind of parallel lives, working inner city practices, and both married to pediatricians and have young kids. So lots in common. Where did I came from? A farm. I grew up outside of Moose Jaw in southwest Saskatchewan, and somewhere along the line, I got interested in social justice and in health, and was looking for a career where I could be a part of contributing to more people being healthy, especially those who had the most need. And so that led me to explore medicine in the developing world. So I spent time traveling in South and Central America, doing projects there, and eventually, after a bit of work convincing them that it was a good idea, got into the College of Medicine in Saskatoon and studied there, and continued to have that interest in that direct service, but also started to look more and more at what are the larger structural forces at play that are making the patients who have the highest need have the highest need. Why are people sick? Why are people poor? What is that old line? When I give food to the poor, they call me a saint. When I ask why they're poor, they call me a communist. Anyway, that's Dom Helder Camara from Brazil. So really got exposed to some of those liberation theology and landless farmers movement, etc. in Brazil. That helped get me more politicized and conscious of those larger factors. And then in medicine, as you know, we learn about.
I find it very difficult to hear you.
Am I a little too quiet? I can certainly speak up a little bit more. I'll speak that way a bit more.
I hate to miss a word.
It's okay. I was in politics for a little while, and I got louder. And then I went back to family medicine, and I got quiet again. So I appreciate you asking me to speak up. Thank you. So yes, along the way, got more interested in working in the developing world, but also recognizing the way in which we have very much the same challenges here in Canada and where I live in Saskatchewan. And as you know, Dan, when we're training in medicine, we learn about how to diagnose the patient in front of us, but also to ask those questions about what's behind whether or not people will be sick or well. And we learn, much I think to the chagrin and surprise of all these wannabe doctors, that actually hospitals and clinics are way down the list, 10th, 12th thing on the list of what makes the biggest difference in people's health. it's income, it's education, housing, nutrition, social supports, the wider environment. These are the factors that make the biggest difference. And that nagged at me as I started practice and working in inner city Saskatoon and rural Saskatchewan and over in Mozambique. I just kept enjoying the life of seeing patients, loving being able to be there in people's lives, hear their stories, be part of offering some sort of help, and yet being frustrated at knowing that while I could help out a little bit with a prescription or a referral, I would then end up just sending people back into the situations that made them sick in the first place. And so that's why I decided to get more involved in politics, first as a volunteer and eventually as a candidate and as an MLA and leader of the opposition in Saskatchewan.
So that actually leads, I think, nicely to my next question, because I think Josh said at the beginning, this is your second book. Right?
Mm-hmm.
Your first book was A Healthy Society, How a Focus on Health Can Revive Canadian Democracy. And you published that in 2012, so more than 10 years ago. And I remember reading that book and, really seeing it as a how-to manual of how to use politics to act to improve health through all of those mechanisms, this, health in all, social determinants of health policy. And now you've written your new book, A Healthy Future, and that book is almost an example of what not to do, right? After you were both, a physician treating patients, also, leader of the opposition in the Saskatchewan legislature, straddling those two worlds. I'm wondering if you can reflect on what was the experience like, right? Writing that first book, which was the how-to manual more than 10 years ago. And now, we're not post-COVID. COVID's not behind us, but we're past, hopefully, the most intense lockdown restrictions. We're, at a different phase now. And now writing this your new book, A Healthy Future. What was it like sitting down, writing those two different books?
Yeah, it felt a bit ironic because the first book was leaving medicine to practice politics, and the second book was leaving politics to practice medicine again. It was interesting. I'm going to think a little bit about how to say this. Writing that first book was very much in the hopeful sense of this is what I think we could achieve if we took a particular approach. Writing that second book was coming out of trying that approach, seeing some of it work and some of it not. To some degree, because I don't know that I stuck to my own how-to manual as much as I would have hoped to. That's part of it. The other is just that every plan survives until its first contact with the enemy. Things change when you get into trying to apply it in a much more complex real world situation. What I thought was important about the book, and the reason I felt it was really necessary to write it as I was leaving politics, was because that experience of the peak of the global health emergency, the pandemic, was so all-consuming, and such a time where the importance of health as the major factor in our lives was laid so bare. A major threat to our health and our ability to provide care to those who are sick came upon us suddenly, and everything stopped. And with good reason, we stopped and focused on how do we make sure we protect people and keep people safe. And then as waves went on, our ability to do that effectively got worse and worse. And that's not to say we should have continued to do what we did in the first waves for every subsequent wave. It's that we got less and less, we got further and further away from being guided by the best evidence and the best policy, and got more into, got further away from we're all in this together and more into who are the bad guys and who are the good guys, and the messy, partisan, polarized politics that I think are worse now than they were before the pandemic. So I felt it was really important to dig into that experience of a time when health was really leading our discussion of politics and explore what worked and what didn't, and to try to extract some lessons for us all. Also for myself, I wrote this book partly as know if therapy is exactly the right word, but to process what that was like. My own experience in politics and as a physician leading the opposition during a pandemic. And for me, it was extremely therapeutic. I remember the day I sent the manuscript off to the publishers, just feeling like this weight was off my shoulders. Like I'd actually thought enough about this and dug into it. And I say that because a lot of people, when I tell them about this book, they're like, "Oh, Ryan, we like your writing. We know what you write about. God, why would I want to read about COVID now? We just got over talking about this." And that's a very natural response. But what I'm hoping is that those who do take the time to read it will get some of that same cathartic experience of going back, actually looking at it through a more structured lens and being able to remember their own experiences, process that, and not feel so scared of thinking about that time anymore. And more importantly, feel equipped with some lessons to actually do things differently.
So those of us who are here, right, we're in Ottawa today, and then if you're listening or watching this, you may be in another part of the country. But this book is very much about Saskatchewan, right? And I was reading it and I thought that we had bungled the response in Ontario, but I mean, maybe this is me showing how Ontario-centric I am. I was shocked at how much worse the response was in Saskatchewan and how much more politically obtuse Scott Moe was and the Sask Party were, even more than our progressive conservative government here, which definitely didn't win any gold stars. But that aside, for people who maybe didn't realize just how challenging it was in Saskatchewan, if you're not in Saskatchewan, if you're here in this room in Ottawa, or if you're watching or listening in another part of the country, why should we care?
I think it's one I do try to bring in and talk about things that went on in other parts of the country, the different approaches between, say, the Atlantic bubble or how BC approached it, etc. But the truth is, what I knew the best was Saskatchewan. I kind of look at it this way, though, because the other thing that happens in this book a lot, and in my writing always, is I dig into the stories of individuals, whether it's patients that I saw or people who were very public about their battles with COVID or losing loved ones. I sat down with them and learned more of their stories and share those stories in the book. And I feel that's a really important way of getting a sense of the general, is to dig into something specific. To get into one person's life allows you then a window into the broader issues that were affecting so many different lives. And the same is true to dig into one province's response in more depth, helps us think about, you reflected on comparing that to your experience in Ontario and what you saw here. So I think anyone who reads this, they might learn a bit about Saskatchewan, but it will also shine a light on what was done across the country and even other places in the world. In terms of Saskatchewan, I think, talking to an Ontario audience, I think about the Delta wave. And when you talk about the Delta wave in Ontario, it's sort of the wave that didn't really do that much. Things weren't that bad. Whereas in Saskatchewan, it's where we got blown away. And there's this moment that I start the book with this moment. The chief medical health officer in Saskatchewan is Dr. Saqib Shahab. And he was the voice and face of the COVID response, as chief medical health officers were across the country. And in October of 2021, he's doing one of those regular press conference updates. And the most informative moment in the entire pandemic in Saskatchewan was 20 seconds of silence. Because he was trying to explain what was going on. And he started to choke up. And one of the reporters said to him, "Dr. Shahab, are you okay?" And then he started to sob a bit, and he couldn't get a word out. And he finally found his voice and just said, "I can't believe that we're here at a time when we've got free available vaccinations. We've got so many resources to protect people, that we're in this state." And what did that state look like? It looked, and this is very relevant to where we're sitting today. There's a guy by the name of Ken Roth. up in Loche in northern Saskatchewan. He's Métis, was really involved in his Métis local. He's the maintenance guy at the local school. And in summer of 2021, he came down with COVID. He was hospitalized in Saskatoon, and then he was flown all the way here to Ottawa to be in the hospital, because we had so many people in our ICUs in Saskatchewan that we were flying. A couple of dozen patients had to come all the way across the country to be in the ICU here in Ontario. And Ken is a residential school survivor. And so when he had that experience of, he didn't really get much warning. He was just taken away. And he said the first thing that came back to him were all of these memories of getting taken away from his family and being separated from his family when he was a kid. And now here he was sick in a time of need, getting pulled across the country with no warning. And his family had to drive across Canada to come see him. And there were dozens of stories like that. People who didn't make it through, people who wound up having experiences like his. He spent over a year in the hospital, and just so many more folks who were really deeply damaged. And what were they damaged by? They were damaged by choices. They were damaged by a government that looked at the evidence in front of them. We learned this around the same time that the Premier had been shown very clear modeling of the Delta wave coming. He'd been shown it in June, and he went out a couple of days later and announced that no more efforts to get more vaccinations in place, no more measures whatsoever, were done for good. Had that information in front of him, and the modeling turned out to be exactly right. So it's, I think, helpful to dig into the Saskatchewan story, because there are some really egregious examples of things that went terribly wrong, but also just to dig into any one example of the response helps us to think about what were the principles that were followed and worked, and what were the things that were ignored and wound up with real people getting hurt.
Yeah. You know, you have so many compelling stories in your book. I want to ask you about another one. You describe meeting another doctor, from Saskatchewan, Dr. Palangi, who practices in rural Saskatchewan. He's originally from the Democratic Republic of Congo, trained in South Africa, and he saw firsthand the rise of HIV. Can you tell us how you met him and the conversations that you had?
I met him on my first day on the COVID ward in Royal University Hospital in Saskatoon. When I got into politics, I worked a little bit in medicine, and then I decided I need to focus entirely on leading this party, and I'll just do a bad job in the clinic end of politics. So I let my license lapse. Then when a global pandemic shows up, first call I made was to the College of Physicians and Surgeons. How can I help? And so I signed up with an emergency license and worked in testing centers, vaccination clinics, did weekly clinics in the homeless shelter in Saskatoon, and also some time in internal medicine on the COVID ward. And that first shift, you're a little bit scared. It's intense to show up and be, doffing and donning in ways we never had before, the full face mask and gowns and everything, and going into the COVID OBS unit where patients are on ventilation, and so that the virus is being aerosolized and spread about. So you're thinking about your own safety and how to make sure that you're not going in there and then bringing the virus out to someone else. And that's where I met Dr. Plum. But I didn't meet him at the desk talking through charts. I met him lying face down on his hospital bed, because he had been working in Kindersley in the hospital there and had caught COVID himself. And he'd wound up getting very, very sick. So here's somebody who'd been working hard in the hospital to try to support patients. And there had been some failures in terms, and he talks more about this, and I shared in the book, about the degree of information that had been shared, the supports for his hospital to actually protect the people working there. And so he was quite frustrated with the government for the fact that he had wound up getting sick in the line of duty. And then he had been in the in the ICU and thought he was going to die. Still, the last time I talked to him was a couple months ago, still having trouble breathing now months later. So it's just stories like that of people who are doing their best, trying to really step up, but weren't supported by the health system, weren't supported by the government to be able to protect themselves, and wound up carrying a really difficult burden.
As you come closer to the end of, or as you begin to talk about successive waves, you've already alluded to it a little bit, the kind of failed attempts at vaccination, and also the mixed messages from the premier about getting everyone vaccinated, but then suddenly, stopping a lot of vaccine efforts. You talked a bit about the link of Saskatchewan to Ontario, but we're in Ottawa, and another significant link was the way fears and anger were stoked, and how that connected to the convoy that rolled into this city. Can you speak a bit about how you saw misinformation, vaccine misinformation grow, and how that linked to the events that happened here in this city?
One thing I want to, just before I dive right into that, because it's really easy to focus on what went wrong, and there's a lot of things that we need to learn about what didn't work. It's also worth talking about some of the things that were amazing successes. And the fact that we went from a novel pathogen nobody had ever heard of before to not one, but multiple effective vaccines in a year, that is incredible. If that hadn't happened, if they'd failed in the search for a vaccine, what kind of a conversation would we be having today? Well, we probably still wouldn't be gathering in a room like we are. And not only that, it was discovered, invented, formulated within a year, and then it was distributed at lightning speed. And I think about the folks in the Saskatchewan Health Authority who are behind the vaccine efforts, and cruising around in my car with coolers, going to different group homes and showing up at long-term care centers with surgeons and infectious disease specialists. We were just so happy to be part of the solution and delivering those vaccines. And people came out, especially in those first offerings, first shots, people came out so excited, so happy. Remember the joy of sitting with we're here hosted by the Douglas Coldwell Leighton Foundation, talking to a woman. One of the first vaccines I gave was to a 90-year-old woman who remembered meeting Tommy Douglas and was just so thrilled to be getting out of her house, able to meet with people, able to chat with me and get that vaccine. There was such hope and such great things done. And then how sad it is that turned over time. And we already had the anti-mask, the anti-vax stuff going on, but the fact that mainstream leaders and politicians latched onto that, gave it space, and we saw this shift from Saskatchewan being, again, we were doing great in some ways. We were leading the pack in April and May of 2021 in rates of vaccination, and then it just stalled out completely. The government chose to do no further. We called for a last mile effort. Let's, whatever it takes. It's getting into at-risk communities, it's getting into schools, it's offering incentives, whatever we need to do to get to the level that will really have us have some degree of herd immunity and protection. And that was discarded. But then it got worse. And we had the premier writing this all caps love letter to the trucker convoy, basically saying, all aboard, you're doing a great thing, going to Ottawa, giving them his full support, indicating that they'd be just as welcome to come to Regina. Fortunately, the folks at our legislature were a little more ahead of that, and we didn't wound up having the kind of occupation you did here. But I never thought I'd see such a thing as a headline in the Saskatoon Star Phoenix saying, Premier repeats falsehoods on vaccines. He just straight up told the people of Saskatchewan lies about the vaccine. And you saw the effect immediately. Nobody went for any more vaccines. The next rounds of boosters, our rates are now among the lowest in the country. People are seeing big drops in measles, mumps, rubella, all of these other key childhood vaccines that we're seeing lower rates in and outbreaks of those diseases. The impact of that, of the cynical tying themselves to the worst elements of the political response, just such an abdication of leadership and so dangerous. And so I think when I talk about what can we learn from that, I mean, one is that we have some work to do to fight for the facts, to be able to fight for real information and objective information and good evidence in the face of well-funded and politically motivated BS. It's going to be a lot of work. And I talk a little bit about that, some of the ways we could do that. I don't know if you want me to get into that yet, but I'll dive in for a second.
Sure. Yeah, absolutely.
Talking about, one of the things that happened early on in the pandemic, we saw information being choked. We didn't get the full story, and we didn't get full information. For example, the first woman who died in Saskatchewan, Alice Garreau, I talked to her sister Eleanor, and she said how Alice was watching the news and wanting to know what was going on with COVID. They weren't saying that there were any cases in North Battleford or any deaths in that area, or any cases in that area, so she thought she was fine to go out. There were cases in the area, and Saskatchewan knew, but they didn't tell that story. And so she went out and caught COVID and wasn't around very much longer. And there's a lot of people who are making those decisions without the information they needed. But there's something even more insidious, is when you hide the information, when you don't trust people with the truth, one, they can see through it. They know that they're not getting the full story, and so they go to other sources. And there's going to be other sources waiting to fill that information gap and fill it with whatever is going to serve their grift or their agenda in whatever way. And so that element of seeing the Premier limit information, encourage misinformation, and then ultimately just shut down sharing any data at all is very distressing, and I think needs to be a huge wake-up call to us as a country of how do we fight for good evidence to be out there.
I want to ask you one more question, then we'll open it up for questions from everybody else. There were a number of other lessons that you shared as you closed out the book. Could you speak a bit more to the opportunities that you see to improve things like our health system, Medicare, long-term care, but also, harkening back to your first book and how we opened the conversation, some of these non-health system-related issues that can improve health, like, for example, precarious work?
I think we learned a lesson. We learned information we already knew. We knew how important health is. We know how social determinants impact health outcomes. We saw what we usually see in 5 years, 10 years, 20-year cycles. If you invest in early childhood care now, kids who are 10, 20 years old, they will have much better quality of life. As adults, they'll have better jobs and live longer, healthier lives. That's the usual upstream arc. But now we were seeing a situation where public health decisions and investments made today could make a difference within a week. A mask mandate brought in now could be saving lives by a week later. So that river of upstream was flowing so much faster than ever before, and really brought those ideas to the fore. And I think the things that I would want to re-emphasize coming out of COVID is, one, health is the most important thing. It's the best measure of whether we're doing well as a society. When we're getting health right, it means we're getting the other stuff right. We're getting education right. We're getting economic development right. And it's the best measure. And it's something we can measure. We do measure the rate of illnesses, the length of our lives, all of these things that we can see. Did you see the latest studies on, or the latest numbers on life expectancy in Canada? Saskatchewan has dropped from the highest life expectancy in the early 90s to the lowest. We're now 3 years below the national average. These decisions have impact, and when we measure what's going on, we can see it. So there's that measurement, and then there's the roadmap for how to get there. When we invest in the social determinants, when we invest upstream, it makes a difference. And when we allow inequality to grow and poverty to grow, things get worse. Because it wasn't just COVID that was driving those drops in life expectancy. It's been going on for years, and it's directly related to inequality and poverty. And we saw how COVID was able to find those fissures of inequality in our society as well. You look at some of the studies in Toronto and Montreal where areas, postal codes with lower socioeconomic status, or people who don't have English or French as a first language, or Indigenous people were much more impacted by COVID, much higher rates of illness and death than neighborhoods that were wealthier, folks that had more advantages. So I think those factors are really important when we talk about healthcare. One thing, Dan and I worked on the board of Canadian Doctors for Medicare for years, fighting for, and Dan is still there, fighting for publicly funded, universally accessible healthcare. And that lesson is further underlined. Public care is still the best care. One of the reasons we did so much better than the States, and we did do so much better than the States and Canada, is because of that service being available to everyone. We were talking, Danyaal Martin and I last night, founder of Doctors for Medicare, about that story of people coming from Saskatchewan to Ontario hospitals, which isn't great news in Saskatchewan, but it's actually kind of a beautiful thing that when we were in trouble, there were hospitals in Ontario that said, oh, well, send us your patients, of course. In New York, there were empty hospitals down the street from hospitals that had their ICUs overwhelmed, but because they don't have a system, because those were private hospitals that wouldn't accept those patients just died. So there are things that were shown to be worthwhile, but where we've also seen the massive stressors on public health care. And I think the biggest message for us in public health care is we need to build some slack into the system. We've been redlining our healthcare system, asking people to operate at 125% efficiency at all times. In Saskatchewan, we even tried to use the Toyota Lean model to reinvent how we do healthcare, have people never stopping to sit, never stopping to listen to their patients and take the time, never stopping to have the time to ask each other, hey, should we do this differently? Should we do things a little better? Are we doing this right? Let's build in some slack, some added capacity so that in the lower times, we can get deeper and do better. And when things get bad, we're able to respond more quickly instead of completely wiping people out as we did from 2020 to 2023.
Okay. Well,
Lots
Ryan,
of thoughts there.
Yeah. I mean, this is just, we've been talking for, 20, 30 minutes. This is just a taste of what's in your book. And, I'm saying this not just because I'm your friend, but because I genuinely enjoyed the book. And it is this like remarkable mix between a memoir that is deeply connected to public events and has stories connected to these broad policy issues, and really, I think, brings them to life, whether you're in Saskatchewan or in any other part of the country. So Ryan, thank you so much for spending some time with us. And I hope many people crack that spine and take a look at those pages, because it's a wonderful book. Thank you
very much. I appreciate that. And I'd love to hear thoughts from folks in the audience today. And I'll repeat the question for folks who are watching the video. If anyone has any questions or comments, please go away. Go away. Please go ahead. Stay. Tristan.
Thanks. Yeah, I mean, obviously a huge honor to have the first question, just to be the first to thank you so much for all that you shared tonight, and obviously all the advocacy that you've been doing throughout those difficult times. I guess my question, I wanted to bring it back to the pandemic, and I was kind of struck by this idea that, the shock of the moment brought us back to our roots, our instincts, almost our bare instincts, and going out there and doing whatever we could within the realms that we could influence. And for you, that was healthcare and politics. And, I think you spoke, very keenly to the fact that healthcare really, kind of knocked it out of the park in terms of saving lives for Canadians, whether it's, the practitioners on the front lines to the public health officials, and the development of vaccines. But then on the flip side, and for someone like yourself, those instincts clearly is politics and healthcare. And I'm curious about the political side of things, where I think it's quite clear that the failures, a lot of them revolved around political decisions. And so I'm curious about that experience that you had being in this position of political influence and so close to the Premier of Saskatchewan and those surrounding him making these decisions that failed the people. I'm curious about why you think they made those failures, and what we can kind of learn about how these actors that failed us acted, in positions where we were in crisis.
So just to paraphrase very quickly Tristan's question, we witnessed political decisions, poor political decisions being made, political malpractice, some might say. Why did that happen? And why do you think that we went down that road of poor decisions? And I go to the very first moments of the pandemic in Saskatchewan, and I think there was this enormous missed opportunity. And it's when I think back, what disappoints me the most. It was March of 2020, and we have fixed election dates in Saskatchewan. So every 4 years there's an election. And that was brought in by the current government, but they decided that they had a chance to off guard and go early. So they were planning an election 6 months early. And it was the worst kept secret in the province. Everyone knew. They were, at one point they were actually competing with Saskatchewan Health wanted testing sites and elections wanted polling sites in the same school gyms. That was a little bit later, but this was going to happen. We were going to have this snap election, and then along comes COVID. And I said to the Premier, hey, can we not go door to door, shake everyone's hand, have these big rallies, gather people together? Let's hold off and just do it at the regular time. And when I asked that in the legislature, they laughed. The Minister of Rural and Remote Health was yelling, what if? The Minister of Finance called me Dr. Doom and his caucus of gloom. And very strong reaction in the crowd. It was stunning. And it was stunning because it just was so removed from, this is a very serious issue and something we should take seriously. And this is the house of serious business in the legislature. And instead they were mocking these public health concerns. Now, days later, they did finally cancel that election. But I think it was from that very moment where in the House, I asked, can we work together? Can we form a committee with opposition and government, municipal leaders, business, labor, education, get everyone around the table, First Nations leadership, and be able to decide together how best to respond to this? And that was an offer I made repeatedly. And I just feel like that was such a missed opportunity. There was this moment early on that you'll remember, the sense that we were all in this together, that we may be apart, but we can stick together, people banging pots and pans for the healthcare workers. It was kind of beautiful, but it never translated into that cross-partisan, across the aisle work, at least not there. There were examples in New Brunswick and Newfoundland and other parts of the world where they did much better and had better results because of that. And I feel like instead of getting closer together and finding some of that common ground, instead the distance between parties and the polarization has gotten much worse than it was even before COVID. Mr. Ruh.
I'm happy he asked that question because I'm actually going to push back on my neighbor's first question. It was being characterized as failures by the. And I guess my overall question is am I too pessimistic or attributing too much malice to the government? But we know how governments of that stripe feel about healthcare. Isn't that perhaps a design? By design, it was the worst healthcare performs, the more likely it is to move to a different model. And if outcomes are poor, they can say, see, this just doesn't work. Everything's collapsing when we try to do it this way. Let's look to our neighbor to the south, the United States, and let's try that model. I almost think that, I don't want to say they were trying to kill people or anything, that's too malicious, but isn't it a good thing if the system you don't like fails? And you want to replace it with something else?
Yeah. So to paraphrase, was some of the failure to respond effectively to COVID deliberate, allowing the healthcare system to flounder and then having further excuse to call for privatization to say, look, Medicare just doesn't work? I wouldn't go so far as to say they looked at this moment and said, we're going to allow this to overwhelm us and allow that to happen. I think it's a longer term pattern that is real. That the example I always think of is Via Rail. Via Rail it's CP, right, that was required to run Via Rail as part of their contract to have the access to the railway.
Yeah.
And they didn't really want to do that. It's not where they make their money. And so they just kept making the service worse and worse and worse until they were finally able to convince people that they shouldn't run it anymore and got rid of it. And I think sometimes you see governments in Canada try to undermine public investment in public healthcare and other public services. Think about education in Saskatchewan these days, in order to be able to make that argument of, look, public just doesn't work. We're going to have to go to something that is private. And I don't know that anybody was that deliberate or Machiavellian in response to COVID, but I know for sure that here in Ontario, in Saskatchewan and Alberta, there's all kinds of governments that are using how hard that was as an excuse to privatize more. And that's what I think, it's never let a good crisis go away, never waste a good crisis. They're not wasting this crisis. They're trying to push their agenda, despite the fact that, returning to the evidence, and this is where, Dan, weigh in if you want, but better than anyone in this room how clear the evidence is that public health care is the way you deliver affordable quality care. Going down this road of we have trouble in public health care, so we need to go private, is a terrible argument, because that's saying things are bad, let's pick something worse. And unfortunately, it's worse for the public. It's not worse for some folks who would profit off of that, and those are the folks who contribute to the parties who think this is a perfectly good crisis to exploit.
Ryan, so thanks for the opportunity. There's this narrative that's out there that healthcare spending in Canada, public healthcare spending in Canada, is somehow out of control or unsustainable. Historically, we spent about 70 cents out of every dollar publicly and 30% or 30 cents privately. But when you compare our healthcare spending on public healthcare to countries like the United Kingdom, Germany, France, Sweden, they all spend 80% or more, right? So more than 10% on public spending. And for us, Medicare has stalled in the first phase of what Tommy Douglas envisioned, which was to cover doctors and hospitals. And even now, we're struggling to expand Medicare to include things like prescription drugs. So there's this popular narrative that public healthcare spending in Canada is somehow out of control or overblown. But when you actually look at our international peers, we're underspending. And it's this sort of narrative that I agree is absolutely propagated by governments who don't want to invest not just in public healthcare, but in public services, in general, the sorts of things that social democrats and democratic socialists believe in, that allows this decaying in services. So it's so important for us to correct the public narrative and to stand up to not just defend the principles upon which programs like Medicare are based, but to actually fight for something better.
Yes. Hi.
So, Ryan, I think you were in a unique position during this period, right? You were the leader of the official opposition. Uniquely frustrating, probably, the way that you were describing the fact that fewer people are getting vaccinated, even for those vaccines that used to be essentially ubiquitous. seems like, the exact antithesis of what your mission has been in life to create a more healthy society. How personally did you deal with those frustrations? You seem like a pretty cool, collected guy up there on stage, but I imagine that must have been, in the moment and even now, quite a difficult thing to deal with. And was your position as the leader of the Sask NDP a boon? Did it allow you to feel like there's this opportunity to organize and to build opposition and to fight against the Mo government, or did it feel like there wasn't an opening and that you were being sort of ground down in opposition and it wasn't giving you the space to express those frustrations in a constructive way?
Yes, is the answer to that question. So, what's your name?
My name's Ethan.
Ethan. Okay, so Ethan's asked about sort of how I responded to this personally. Was I able to stay cool? Did I see this as an opportunity, or did this kind of grind me down? And the answer is yes. There were ways in which this was if you're going to be a doctor in politics, being there at that time, it's almost a bit too on the nose, but felt very much like, okay, this is the moment where I'm in the right position. And I do believe that even though the outcomes in Saskatchewan were far worse than they could have been, they would have been worse if we hadn't stood up. There were so many times when this government was just going to not act, and we forced their hand, not as quick as I would have liked, not as well as I would have liked, but better than it would have been. So that felt worthwhile. And there was a bit of this sense of a moment, of a battle, of being in the midst of something really worthwhile. And that was exciting. And at the same time, it was extremely frustrating. And I know I did lose my cool at times. I called the premier and the health minister stupid, irresponsible men in a press conference.
Sounds like a nice press.
Whether that was a good description of their
not
actions or
wrong.
not, I'll let others say not wrong. But it wasn't helpful, right? I wasn't getting us anywhere. I wasn't going to reach anyone. But I was feeling not just my frustration, but the frustration of all of those people who are calling me, tweeting at me, saying, "Do something," and recognizing that the only tool I had to do anything was to speak, and did that as well and as often as I could. I'll be honest, by the end of it, I was burnt out. And I talk about that in the book as well. Pretty candid about my own struggles with mood, etc. by the end of my time, and recognizing that as I was going back to politics being normal politics, going back to the rubber chicken circuit and the banquets and knocking doors, as much as I think that's important and valuable, it's actually really hard to shift back to that after that time that was so intense and felt so important and so vital. And so I think I realized that the work still matters, but it wasn't going to be me for a while. Josh, our host.
Sure. Thank you. I remember in the throes of the pandemic feeling so vulnerable, like so many others, that our governments were so unprepared. I recall everyone being so anxious about the vaccine and the fact that facilities that used to exist in Canada no longer did, and that we had to be reliant on other countries for help. Considering your book, specifically on lessons of the crisis, have our governments provincially, has the government federally learned a lesson? Are we better prepared now for the next thing that might come down the line? How serious, if we see another coronavirus or something else, are we in better shape now? Have the proper investments been made?
So again, to paraphrase, did we learn our lessons? We were unprepared. Are we more prepared now because of this experience? And this is why I wrote this book, because this is what I'm afraid of, is that rather than getting more prepared, we may be even though we now have a generation of practitioners and people in administration and leaders who know how to mobilize the logistics for things that they didn't before, there would be some greater knowledge about transmission of infections, etc., there are also this built-in resistance now, where there's so many people who are cynical about anything that is said about a new illness, about our response to the pandemic, that I worry that we would start with that resistance instead of even having that window that we did at the beginning, where people were willing to engage and sort of give the benefit of the doubt to the leadership and respond quickly. I don't think it has to stay that way, though. I think that's where we are right now in this moment. But that there's work that we could do to get us to a better place. And some of that work is, this is one book investigating one aspect of the response and thinking about some of the ideas. But I think it's a seed for what needs to grow, which is a deeper investigation into what happened in each province and across Canada. And that needs to include stories, that it needs to include a chance for people to share what happened to them and what happened to the people that they lost. So we attach real human lives to those statistics and numbers that can get so mind-numbing over time. And we need the inquiries. They need to happen. We have a promise from this federal government. They've now replaced their health minister. Who knows if he's got any commitment to a federal inquiry? We haven't seen any movement in that direction. BC's done something. They did a partial inquiry. Saskatchewan, Alberta, Alberta's got Preston Manning doing an inquiry into how we overreacted in the worst, the worst provincial response in the country, except maybe for our own. We need to be curious and dig into this, and if we are, we can learn a ton and be so much more prepared. But if we're dumb and we stick our heads in the sand and refuse to learn and just say that was hard, so I don't want to think about it, then we'll be stuck repeating the mistakes or making even worse ones next time. Okay, folks, I think we're wrapped up. Thank you so much, Josh and the Douglas Coldwell Leighton Foundation for hosting. Thanks, folks, for showing up. And Dan, thank you so much for asking the tough questions.
Of course. Thank you, Ryan. Thanks so much for doing this.
Thanks, Dan. That was really great, folks. Thank you all for being here. I wish more people had joined us tonight. That said, the video recording of this will be made available on our website, and a version of this will be converted into a podcast, made available on iHeartRadio, Spotify, Apple, wherever you get your podcasts. And so we'll let everybody know in our newsletter about the video when it's up. I want to thank Dr. Ryan Mieli, again, my good friend. Thank you for making the trip all the way to be here. Happy here. And Dan, I'm looking forward to us working together more closely. And I think going forward, these kinds of events when we talk about healthcare and Medicare here in the country is so important. The conversations are important to dissect them. And I think that you can expect a lot more from the foundation in the future on these important issues. So thank you all very much for being here. Please join us. Stay a little while longer. We do have some food for you, so we'd love to share.
And we do have folks from Octopus Books at the back with books.
There you go, Octopus Books, your progressive bookstore in Ottawa.
Happy to scribble my name in a book if anyone would so desire.
Please do. Thank you all.
Hey, before we tear things down, Patrick, would you mind a couple of photos?
I don't mind at all.
Let's do a couple of Dan and I.
Okay, you will text those to me.
Yeah, Dan and I